I once overheard a senior physician say to a colleague, "This new generation just doesn't have the same work ethic we did." And then I heard a young nurse once said to me during a coaching session, "The older staff are so resistant to change, they think their way is the only way." We keep having the same conversations across different decades, blaming each other for challenges that we have nothing to do with age and everything to do with how we are choosing to see each other.
Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between.
Welcome, everybody, to a new episode of the Transforming Healthcare Coaching. So, I once overheard a senior physician say to a colleague, "This new generation just doesn't have the same work ethic we did." And then I heard a young nurse once said to me during a coaching session, "The older staff are so resistant to change, they think their way is the only way." And both were exhausted. Both were brilliant at their jobs. Both were convinced the other generation was the problem. But here's what I've noticed coaching healthcare teams. We keep having the same conversations across different decades, blaming each other for challenges that we have nothing to do with age and everything to do with how we are choosing to see each other. And today, we're exploring how healthcare teams can bridge the generational divide, not by ignoring our differences, but leveraging them. Because the truth is, we need each other more than we realize. I'm joined by Vicki Landers today, one of the coaches at Transforming Healthcare Coaching. And Vicki, we've had you on an episode before, and I think people already know you, but I'd love to hear a little bit about you and why we're talking about generations today.
First of all, I'm super happy to be here. I love talking with you, and I love sharing this kind of information with people. My background is I'm a physical therapist who moved from physical therapy clinical practice into management and leadership, and actually moved into the world of strategy and IT analyst application and a lot of communication. I spent a great deal of time translating IT and technical speak to clinical and clinical into IT and technical speak. And what I found along the way is that communication is so important and styles of communication are really important. And honestly, I'm going to give you my bottom line right from the beginning. And the bottom line is nobody's communication style is good or bad. They're just different. And when we as people can accept that younger generations have been enculturated to communicate a way, older generations were enculturated to communicate a different way. If we can just embrace that and let go of that judgment, it would move us forwards so much, and let go of that judgment and actually open up the opportunity for us to actually communicate and learn more from each other.
Wow.
There, I just summarized us.
You did. You summarized this episode completely already. We can end the call now. So I love the background that you have, obviously, as a physical therapist, as a coach, but with your background in communication. But I guess what passion developed as a result of generations? What were you hearing that said, maybe we need to talk about this a little bit more?
I think it was fascinating. I was orienting a young clinician. She was a nurse, and I was doing some training with her, and it was technology training. And in the conversation with her, this is a girl who was 24 years old. This is about, 8 years ago. She says to me, "I need technology. I don't want to deal with this." And I was completely confused. I was like, wait a minute, you're of a generation that got brought up with cell phones and computers. And so it got me to thinking that we have this idea of generational expectations, but that not everybody fits into that mold. And that was like my first thing that I was like, okay, things that it really is more about expectations of people. Then it sort of expanded into talking with the younger clinicians and students. And one of the things that I also heard people say was, well, I don't want to make a phone call. I don't want to talk to them. Whereas some of our nurses who are more baby boomer generation, they're like, please don't make me send another email. Can't I just talk to somebody? And so one of the struggles there that I noticed was that the older generation nurses didn't want to send an email to a younger nurse, and the younger nurse didn't want to answer the phone call when the nurse who'd been around longer was trying to get a hold of them. And so it's sort of the observations of what we grew up with and are used to with starting to get in the way of people actually being able to do their jobs really well.
Wow. I think those are some very great examples of things I still see every day. is a lot of that shock that you have when you hear somebody say a challenge and unable to come up with a solution. It's the same thing that I think is happening today with residents and senior physicians is this expectation to work these crazy hours. And I think that's why so many changes takes so long to happen where like, well, I worked the 100 hours, I never slept, and I did all this, so they need to be doing that. That's what's going to make them a great physician. And we know notoriously that lack of sleep and poor nutrition, lack of exercise, lack of mental health days and care is destructive to a human being. So it's very interesting that generational challenges continue to be present. And so I'm curious with some of these conversations you've heard and been around, what have you been doing about it? And how can we begin to change our language?
So I think first of all, coaching obviously helps people see that they're telling themselves stories about other people. So one of the things I like to talk to have people think about is that if I'm trying to communicate to you, so I want to get a message across to you, it's my responsibility to figure out how you can receive the message best. Because you may or may not care about what it is that I'm trying to tell you or trying to convey to you. You may or may not be interested. You don't have the imperative that I do because I've got something important that I want to share with you. So as leaders, I was running staff meetings. I needed to understand how the people in the room could receive my message. If I was giving a new regulatory update or if I was teaching somebody about a change in the software that was going to impact their workflow. So I would think about how was I going to craft this and who was going to be in the room. And I don't know if everybody knows this, but right now we have 6 generations of people on the planet. 4 of those generations are in the workforce. So we have that baby boomer generation, Gen X, millennials, and Gen Z. So I had to think, and I had all of those in the room. So I had to think about how the message was going to be conveyed. So it was always, okay, we're going to do this verbally in person. Can I make a video? Can I send this in an email that has bullet points and has the important stuff at the top and then the rationale at the bottom? Can I send it in tweet-like things? I had to think about what was going to be the way that was going to get to that person the best in the way that they could actually receive it, because that was my job, not their job. It was mine. And so I think that's something that I really like people to consider is that the emphasis is on you to figure out the best way and not to get mad at the other person because they're not receiving it. Modify how we're doing it ourselves, and it's much more likely that somebody's going to be able to receive it better.
I love that. I love how you really took that outside in approach where you're like, okay, let me take a step back. We have all these different generations in the workforce. I've had this experience with different generations where how they respond to certain things and how they would better receive information to understand and grow and reduce potential pushback as a result of bringing up something that's important for the job. One thing you mentioned was remove judgment. I think that is a very tough thing to do. Granted, it's something I practice every day. I'm no way in any way perfect. So for somebody who's new to this concept where this idea of not getting upset about other generations and how they impact your day-to-day life while at work, how can maybe somebody start removing some judgment in their life to have this outside in approach that you developed?
So it's hard. I mean, it can be hard. For me, it starts with awareness, just starting to notice when I'm judging. And as humans, we tend to judge 3 things. We judge other people, we judge ourselves, and we judge situations. A lot of times in healthcare and in work, we are judging situations a lot and we are judging other people a lot. So the thing is just to start noticing it. I've had clients who've actually done a judgment journal where they start to write down when they notice that they're judging other people, and they'll find trends. I judge people about their tone of voice. I judge people about their intellect. I judge people with how fast or how slow they think. And that awareness starts to let you sort of let go and recognize that it's really about me. That judgment is truly about me and not so much about them. And I think you know this, is that one of the things that we start to discover when people start to look at their judgments is that a lot of times we are putting on other people and judging other people for things that we don't necessarily like about ourselves. So that's always the next step. And when you can shift how you think about that about yourself, what happens is you can stop judging other people it actually becomes not even a thing anymore. So judgment journals are a really nice way to start noticing. And when we're talking about intergenerational stuff, you can think about, am I judging them because of their behaviors? Am I judging them because of what they are or they aren't doing? And then start to give people grace. Because again, we're not good or bad. We're just different. And when we can give that grace, let go of the judgment, and start to recognize that we're all serving for a shared purpose, that goes a long way towards improving interprofessional communication. We're in healthcare to take care of people. And I think if people can remember that, that's also a great way to let go of judgment. Because if you accept that give the benevolent assumption that the person next to you who's working with the patient at the same time is there to help the patient, and you're there to help the patient, then it becomes much more collaborative, and we stop thinking about how annoying maybe the other person is in some other way. We're there to take care of people.
That's a great grounding technique when we start to notice judgment. And I totally agree with you where it comes from the awareness. And how to start getting awareness is writing these things down, maybe a journal, picking up on cues. But I think the biggest thing for me when I started to recognize these things is, what is it saying about me and who I want to be as a person when these judgments do show up? Because you're right, a lot of it is us and our own internal perceptions. And a judgment is oftentimes made without any good information. We're making judgments by a first look.
Right. And we tell ourselves stories based upon our own history and our own background. And we make all stories and assumptions about other people and other people's intents. That's something I really like people to think about, is like, what are you assuming about someone's intent? Because we tend to assume that our intent is always good and other people's intents are maybe bad or different than our own. And we make these biased assumptions about other people when we don't need to. But again, it's about us. It's about what we're doing and what's going on in our own heads.
Yeah. And I think what's especially important for the audience now is to maybe start to think about the generational factors, about, is this judgment based off of that? Can I see things from a different lens? Can I see things from their shoes? And I think that's something that I try and do as well, is we all walk different paths. And the reason where they are right now and the judgment you made at that moment could be something that you had no idea. It could be something as catastrophic. If you're judging the way they showed up to work, dressed a certain way, you may be like, oh, they don't care about their work, or they're just a messy person, for instance. Where it could be, well, maybe they're struggling at home. Maybe something really is going on in their life that is happening. And you asking them how they're doing could shift that. And so if you ground yourself in the reasons of why you got into medicine, oftentimes that changes so much. And the way I like to see it is, that's the type of person I'd like to be, is somebody who's aiming to be some more positive, somebody who's trying to make more positive changes in my own culture, in the healthcare environment that I'm in. And so that's another way that I think I can recommend to see things from removing judgment.
What I heard there was demonstrating compassion, and just compassion and a curiosity and a recognition that we don't know what's going on with other people. And I think there's a book that was written, which I am not going to remember the author's name at the moment, but it's all about how our intellect changes as we age. When we are young, our brains are more apt to be innovative and creative and come up with new solutions, because we don't have this whole history and the neural pathways that are so ingrained. And the older that we get, we may not have that innovative creativeness, but what we have is this wisdom that actually makes connections and sees a bigger picture much, much more easily. So we have this breadth of knowledge. And so again, neither kind of intellect is good or bad, but they both exist. And so younger generations, just because you haven't been on the earth as long and you haven't had the same amount of experience, listen to the people who've been around longer for those nuggets of wisdom, because they can put connections together. And those of us who've been around longer, listen to the creativity of people who haven't gotten stuck in their ways, because that creativity is going to be what makes healthcare be able to continue to exist. Because we're in a really challenging time when it comes to rapid continual innovation and changes within payment models and changes within ownership structures and private equity. And all of this stuff that's currently happening, we need everybody on the healthcare side of this to really come together and use the wisdom and use the creativity. And without both, we're going to struggle.
I really love this viewpoint with generations is to begin to see they're both good in their different ways. The different strengths that each generation has that you see embodied in somebody. And I think one thing to be clear here too is not everybody in each generation embodies the same stereotypes.
Right. Like the 24-year-old who didn't like technology at all.
Yeah, that's judgment. And so I love this model though is to know your audience, know your team, know the people that you're working with and what lens they may see things and the challenges they may experience and leverage these as tools to help them, but to also help the team. So I'm curious for the healthcare leaders that are listening here, how can they begin to maybe leverage the different generations into maybe fostering more of a positive culture and leading to just more growth when they're just still struggling with so many challenges as a result of these dynamics?
I think the first thing is paying attention. Listen to the people you're leading. Listen to how they talk. Listen to what their concerns are. That listening is such an important part of communication in general. If we're not listening, we're not paying attention. And I'm not talking about just listening to words. I'm talking about listening with your eyes, watching people's behaviors and creating that collaborative nature. So not pitting people against each other, creating a situation where I like to say we're all sitting on the same side of the table. So the problem is on the other side and we're on this side trying to solve it, as opposed to us being across the table with the problem in the middle. So really thinking, allowing people space to share their ideas and their thoughts respectfully and share them in a way where everybody gets heard, but that the leader is really listening to how everybody is communicating so that they can have a better idea of how to communicate back to the folks that they're leading. And that's in team meetings, that's in one-on-one conversations. We really need to be listening closely to the people that we're leading before we can have any hope of moving them in a direction where they're being more collaborative and being more accepting of the variety of generations that we've got in our workforce right now.
Yeah, that's great wisdom right there. Is really listening to those you work with, which I think is a hard thing to do when you're constantly in meetings and maybe you're working alongside them on the front lines in different shifts and you feel like you already know them because you hear of the constant challenges in the environment or other people's complaints. But have you really sat down with each of your team members and looked at their behaviors, their dynamics? They may be somebody who wants to create change but doesn't know how to do so, and just asking them just simple questions about what's going on, how can I support you, what's working, what's not working, right? And you may get more information about how to make these changes in your environment just by listening.
Yeah. One of the things I like is that, performance reviews are not an annual event. Performance reviews are ongoing. I really like, it's a collaborative conversation, and performance reviews is how are you doing and how can I help you feel better and do better? What do you need? And listening to people when they say that. It's like joint commission. I have a friend who just started working in IT in a hospital, and he's cracking me up because he's like, oh, the window for joint commission is just opened at this hospital. And I'm like, yeah. And he's like, I bet that makes everybody nervous. And I'm like, well, yes. And there's this idea of continual readiness. If you're doing all the things that you're supposed to do all the time, then when they show up on site, it's a little uncomfortable, but you already are doing all the stuff you're supposed to do. So it's the same thing. If you're a leader and you're communicating with people all the time, they should already know what they're supposed to do. But you as the leader need to be really paying attention and really talking to them and figuring out what's important to the individual so that you can support them in a way that's meaningful to them. Because, somebody who is of the baby boomer generation is going to need and want support in a completely different way than somebody who's a new young clinician. They're just going to be different, and there's nothing wrong with that. You just need to listen.
There's nothing wrong with the differences that happen in our healthcare teams. We just got to listen as the first step to figuring out what the solution can be, which is going to be completely unique for your organization and your team. But first step is always awareness, right?
Yes, awareness and attention and listening.
Exactly. And so we, as healthcare professionals, are, or I guess as a society and everybody, always expected to be from your supervisors and managers and leaders and organizations to be the change in you, to make you happier in your environment and to deal with these generational issues and challenges. But obviously, we are at agency for our own changes. And so, what would your advice be for the healthcare professional who is struggling with generational changes? So, from the senior charge nurse who's tired of the millennial nurse, where it may be seen they have less resilience, or new grad who feels like the senior staff are just completely resistant to changes.
It goes back to first, give yourself grace for being frustrated. It makes complete sense that this is a challenging time. It's a challenging situation. So that's the first thing. Give yourself grace. Be like, yep, I don't like this. This is uncomfortable. And then the next one is going back to the who can I be? Who can I be in the situation that might influence other people? Can I approach this not from a victim or a conflict perspective, but maybe could I put the lens of compassion? Can I put a lens of curiosity on? Because it'll make us feel better. If you're frustrated with something and you decide to look at something from a compassionate angle, it feels a lot better than conflict, and start to develop. There's some really interesting research about empathy and about how when healthcare providers get training in empathy, that it actually changes the culture of the organization. And the really fun thing is it changes patient outcomes. So not only are you improving how you feel, but you're improving how your coworkers are, the culture of your organization, and patients. Win, win, win.
Oh my gosh. I think you're the queen of seeing things from different lenses. I could just visualize just like wearing glasses, flipping the lens, and love it because it just flows so naturally just to be like, I'm looking at it this way, put the lens up, I can look at it this way, the way you just mentioned. And I think that is a beautiful pearl to leave our audience with, is that you are at choice to see things differently. And you just need to be aware at the moment when you are seeing things a certain way, from a victim or conflict mode to a way that you would want to show up, and so that you're not feeling the judgment, you're not feeling anger or whatever emotions are present that are not serving you at that time. And so, Vicki, as we come to a close, any final tips or pearls for the audience when we talk about different generations and the challenges that we experience, but some solutions that we can create as a result?
Remember that if you are an older generation, you were once young, and you were once just like these people who you may be getting frustrated with. You may not think you were, but you were. And for the people who are younger, take a look and think about, who do you want to be as you move through your career and through your life? Who do you want to be? How do you want to show up? And learn from the other generations.
Love that.
So that's open up and see what you can learn from people who have had a different life experience than you.
And we're not stuck in our ways. I think that's one thing too, that I think we're all so used to living day by day. It is the way it is, right? When it really doesn't have to be that way. When you know it, these emotions and the way you're looking at things may not be serving you, it doesn't have to be that way. And you have now developed some tools and tricks to begin to see things a little bit differently that serve you, your colleagues, your patients a lot better. And one thing that comes to mind is that I find that a lot of young healthcare professionals don't see themselves as leaders, or they don't see themselves at agency for change, that it should be coming up from the government and your manager and those above you to make these changes for you, to make you happy. But only you can do that. Only you can make yourself happy. And obviously there needs to be systemic changes within healthcare. We all know that. But you need to be the change first for yourself and for the healthcare system as well. We all are not perfect.
Yeah. The only thing we can control is how we're showing up. And we have no hope of influencing anything around us if we're showing up feeling like a victim or showing up in conflict. And if we can help manage, self-regulate ourselves, then we can actually start to have a positive influence. Because the thing that people don't realize is that, well, this is one of my things. Leadership is not a role, a position, or a title. Leadership is behavior. And everybody's behavior influences the culture. If you're a leader and a manager, you may have a little bit more power, but everybody influences everybody else. So if I'm showing up as a victim, I'm pulling everybody down into my victimhood. If I'm showing up with compassion and curiosity, I'm pulling everybody else into compassion and curiosity. We have so much more power to do that than we realize. So we end up with culture by chance instead of culture by choice. We can choose how we show up, which will influence our organization.
Yeah.
Which I just think is it's such an empowering feeling. It's how we show up influences everybody around us. And you can choose. How do you want to influence people?
Thank you so much. This is a superpower that I hope you're able to master, but starting with awareness, I think will lead you towards that. So thank you, everybody. If there is any comments, please send us one. And we're from wherever you're listening. We read every comment, and we'd love to hear where you see generational challenges. And if you've tried out one of these tips that Vicki and I shared today, and tell us, did it work? And what do you want to hear next? So thank you, Vicki, for joining us, and we'll see you next time.
Thank you so much. This was a great time.
Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call free at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.